Getting ready. Hey, Lisa. Hey, Sonia. Hey, Fran. Oh no, hold on. My iPod moved. Okay. Ah, this technology is really challenging, actually. Hi, Lee. We have one more minute. We're waiting for Dr. Tucker to join us. It's been a while. Hey, Susan. Thank you for joining me. Hey, Fan. I guess you're back from cycling. Hey, Lancy. Okay. Okay. I hope I pressed the right button for Dr. Taka to join me. Oh, something. How come it's not on yet, Ariel? I can't see Dr. Taka yet. I know, just now I saw him. See when I add him? Request, unable to join. Why? Yes. Am I friends with him? Oh, there he is. Oh, you started again. Like how we
There
did
we
it the
are.
first time.
All
You're
good?
this way. No,
I'm that way?
yes, you're
Let me
this
see
way.
if I can change that. What, you know, I've,
It's
I've often been a little sideways. I'm kind of.
yeah.
Is that
Okay,
better?
now we are in the perfect. Oops.
Hold on. I can't.
This is cute. This is how we started on our first
Yeah.
date.
Yes. Got to figure out how to. I don't know what I'm going to do here. That's a challenge.
Okay.
I'm still sideways.
You're still sideways.
Hold on. I know,
It's
no.
cute.
That's device. The
It is
ah.
challenging, right?
I just can't unlock the there. Ooh, how's that?
Okay,
Other
now
way?
you're
How's that? No?
okay, now
This
you're right.
not according to Yanti, I know.
You're right now.
I'm all right. To
Yes.
I'm upside down to the world, I think.
Are you,
Oh,
Ariel?
I'm all good?
You are.
All right. We'll stick with that.
I think so. Hi, Dr. Tucker.
Hello, Yanti. How are you?
I'm good. It's been a while.
Too long. Too long. I'm
Yes,
getting
for
older. We're waiting.
oh
We're waiting.
no.
We should do this more often to keep me young.
Me too.
You
So
are
let,
young. You are
let
young.
so for everyone that doesn't know Dr. Tucker, I don't think I need to do any introductions. I think everybody knows, and I'm a huge fan.
Thank you.
Yes.
Mutual adoration.
Aw. And tonight's topic is gonna be interesting.
It's about getting old, isn't it?
Is it really? Do everybody
Well,
has
it's
to go
not,
through with this?
I feel younger now than I did 20 years ago. And if you actually found old photos, at least my wife would say I look better now than I did then. And she loved me back then. So, she's biased, but I still think she's quite honest.
Yes. Yeah, and oh, somebody just adores your collection.
Oh yeah, I'm sure we can show around the toys. We got the claws, we got the dunnies, we got a couple of violent odd things, but maybe for another night, a different topic. Yeah.
Yeah, so I guess we are gonna be discussing a topic that all of us, all of us have to face in our journey of life. To live
Yes.
life to the fullest. To live life to the fullest, we have to go through this.
Well,
And
women do. Men
we,
don't necessarily have to.
that's not fair.
It's so absolutely true and not fair. But menopause is a natural process, and it happens to all women. Andropause, so-called male menopause, well, that happens to some men and for different reasons. But what we're going to talk about, low carb, keto, diet, nutrition, can help both groups.
Oh,
Yeah.
okay. It's
Yeah.
it's it's a choice of a lifestyle.
It's not, well, menopause is not a choice.
Oh, I can't choose not to menopause.
No, I mean, you're a force of nature, so maybe, but for most people, most women, no. Menopause is not a choice. It's going to really happen to all women. So here's the thing. Here's a question. Factual question. What is the average age at which women hit menopause?
I would like to say 55.
51 is the average.
No way.
Yeah.
That's early.
51 is the average, and I think it's 95% of women between the age of 45 and 55. And just because we're doing education, what is the definition of menopause?
Oh. I know. I can't have babies
I know.
anymore.
Pick me. You in the other screen. What's your answer?
I cannot have babies anymore.
Well, that's part of it, but the definition is 12 months without having a period.
Okay.
That's really what menopause is. Yeah, right age and 12 months without a period. For the most part, that covers most of the definitions. And it's, in terms of the science or the medicine, it's a low or very, very low estrogen level and a high level of the hormone called FSH, follicle
Oh,
stimulating hormone. So it's just the ovaries have, been working since you were a young teenager. I mean, that's really almost, 40 years for most people of having a period, most women. And then enough is what the body says.
oh, okay. I mean,
Yeah.
I'm cool without having to
Yeah.
have my periods every month.
Uh-huh.
I'm okay with that. But I don't like the other parts of it.
Yeah. You have
I
a
don't like
top three?
I don't like where gravity pulls me. And myth or not, it says that once you hit menopause, everything goes bloop,
Stop.
bloop.
So, well, age, just getting older for men and women, everything goes south. But lack of sex hormones, and we're talking, estrogen for women, and for those men who get andropause, which, by the way, could be at almost any age, but we'll come back to that, is lack of testosterone. And the lack of those sex steroid hormones, they're going to enhance weight gain. They're going to make it easy for us to gain weight. Or the flip side is it makes it much harder to lose weight. And when I say weight, what I mean is fat. I mean, it gets harder because of the way the sex hormones work in conjunction or in relation to the hormone insulin. Because it's the hormone insulin that you need to have really, really low in order to burn fat. But the things that I think you're referring to, everything going south, I mean, well, bone density goes south,
Oh,
and
everything,
skin
everything.
skin
Yeah.
sags, and what else goes south? Sex
Even
drive goes south.
even my
Um,
bottoms go bottom low.
I only know you face to face, so I'm gonna leave it at that.
Okay, I'm not wearing bikinis anywhere.
I think that's you and me both. But the lack of the sex hormones, it's the other way, one way that I help people understand it is that bodybuilders take testosterone in order to build muscles. And whether it's testosterone or estrogen, it's really easy to gain fat and hard to make muscles without testosterone or estrogen around.
Mm.
And then the other thing, so many things that, I don't know, you can call it going south or going down, but what most women complain of, hot flashes and mood
Oh,
swings and change, usually a decrease in sexual desire, less libido, vaginal dryness, all sorts of major changes due to a lack of estrogen that all, I mean, really, I'm thinking about the hot flashes because now if you wake up every 90 minutes from hot flashes, kick the sheets off, put the sheets on, aircon on, sheets off, right? It's horrible sleep.
it is. It is.
And when
It
you
is.
have bad sleep, then your insulin levels go up again. And it's hard to
Yeah.
lose fat.
Yeah.
Exactly.
It's a
Yeah.
vicious cycle. It's a vicious cycle. With
It's a horrible cycle.
yeah, and I understand. Well, I was not, because of the topic, so I kind of dig my own Google, and I was so actually I I stumbled into this article that says actually pre-menopause start at 40. You said just now you could start 40. So what is pre-menopause?
I think I mean, there are some women who hit menopause before the age of 40. And menopause can actually occur, I think the definition allows for after the age of 40, but before the age of 40, there's a slightly different name for it, and that would just be premature ovarian failure. And
Okay.
I mean, I'm a breast cancer specialist,
Yeah.
and we see a lot of women where, for various reasons regarding their treatment, they're either having their ovaries removed or taking
Mm.
medicine to suppress their ovaries, and that would be considered premature ovarian failure, even if it's temporary. And
What
so
about their hormones?
we think that the hormones can stimulate cancer, so we have to suppress those. Yeah, so for at
Oh,
least 5 years, we tend to use ovarian suppression as one of the treatments to make sure breast cancer doesn't come back. And they also experience the same symptoms of menopause. It's kind of predictable. But before the age of 40, it's called premature ovarian failure. because it's not common nor expected to have your ovaries shut down early. And that's associated not only with the side effects we would talk about that women are always reporting about vaginal dryness and just every skin and mood and on all of those
All the ugly things.
obvious things that they feel and manifest, but there's also things on the inside that you can't feel that are really important, and that is the risk of bone loss and osteoporosis. Men and women have the same risk of heart attack after menopause. So if a woman goes into menopause at 35 or 40, she's increased her risk of heart disease, blood clot, stroke, things like that as well. So we pay a lot of attention to premature ovarian failure, just as much as, and it's a spectrum. And, a 42-year-old woman who just their family, it might be a family thing, a genetic thing. It's not ideal for the hormones to decline at an early age. Yeah.
And can it be prevented by a lifestyle that I'm in favor of?
I think prevent is a strong word, but I would
Okay.
say that living a low carb lifestyle or keto has a lot of benefits. And those benefits, specifically with respect to potentially delaying menopause, but more definitely in managing menopause and life after menopause. And that's because, again, this interaction between female hormones and insulin, because once you hit menopause, you're at increased risk for weight gain and increased risk for insulin resistance. And insulin resistance is this, kind of medical code for why we get fat. And insulin as a hormone has three jobs. First job is to move sugar from the blood to muscle or liver where it can be used. Second job is to convert excess sugar, glucose into fat to be stored. But the one that really trips everyone up is insulin's third and final job is to prevent the burning of fat in the presence of stress or even normal amounts of glucose. You have to have this low insulin lifestyle. And that's what's really helpful in terms of burning fat, and it's counter or inversely related to estrogen. The other thing to think about is what else is happening during menopause. So let's just talk about hot flashes. Hot flashes are going to keep you up all night. And we already said keeping you up all night could cause insulin resistance. If you stay up all night at any age, your ability to resist a bowl of potato chips will go down, right?
Yeah.
That when you're stressed, and that could be physical stress, emotional stress, your willpower changes.
Yeah.
And so you're more likely to have an extra drink. And if you have an extra drink, you're going to have an extra, handful of chips. And if you're more likely to make choices that are inconsistent with your healthy lifestyle. And so by being low carb and keto, you get rid of the cravings. You can, diminish insulin resistance. Your mood is better. It's been shown that now that's after you get used to low carb and keto, because
Yes.
my mood when I'm transitioning from low carb or keto is hard, right? But
Yeah.
it's keto flu's real, and
Keto
you
flu.
have to read and navigate and have a support around you that understands why you're eating the way you're eating. But then mood is typically really high, happy. People are motivated. And the other thing to throw in there, which is good during menopause or andropause, is strength training. Because
Oh
again,
yeah.
you just need
You
bigger
build
muscles.
You
more
build your
muscles.
estrogen too.
Yeah.
Yes.
And again, to go back to the idea of how do you prevent or delay menopause, the more healthy fat you're eating, the easier it is to make estrogen or testosterone. If anybody ever wants to, Google after this, just go to Google Images, testosterone, estrogen, cholesterol. They're identical molecules. They barely differ except for a couple of little, carbons, here and there. But to the non-chemist, you look at it, these are identical pictures. So it's easy to make
Interesting.
more estrogen that way. Yeah. Do you have any
Wow.
questions coming in?
A lot.
A lot.
Well, good. Well, this one is, I think you've answered this. Does keto help with menopause and andropause? Yeah.
Yeah.
Um, how about, like you said, the hot flashes is one of them, and the other one, is it true about the bladder issue though? When you are
Like
when like you go pee like so very often, is that related to menopause?
it can be for some people, and usually for two reasons. One is the muscles might get weaker. So without the sex steroid hormones, especially
Oh,
after having children, that there may be a little more muscle weakness in the pelvic floor, which makes the sense of urgency all the more sudden or acute. The other reason is changes in the way our bodies hold on to sodium. So there may be a diuretic effect for some people where they're, depending upon what they're drinking and how they're eating, that they may actually just start getting more urinary effect, more of a diuretic, similar to when somebody does, low carb, and suddenly they're losing a lot
yeah.
of salt and they have to pee a lot more. So both can be in effect.
Um, does late menopause better for women, healthier, less risk of ovarian and breast cancer? Is that true?
Uh, Let me say this, that the number of periods that a woman has is it technically
It's a risk.
associated with the risk of breast cancer. So later onset of your first period, the more children someone has and the more breastfeeding reduces the number of cyclical estrogen phases. And for some women, it's that cyclical estrogen that is, it's not causative for breast cancer. It's associated with breast cancer. It's not exactly cause and effect. And that doesn't take into account a lot of other factors. But late menopause generally isn't associated with the risk. But early first period and the more periods in life is associated with breast cancer risk, but not ovarian cancer risk. Yeah.
What is a surgical menopause?
That's when, for one reason or another, the ovaries have been removed and it
That's
creates
called.
menopause. I mean, we have patients, whether they're cancer patients or people with, what's called endometriosis, patients with polycystic ovaries, where in the most severe forms we give medicine that can induce menopause, temporary induction of menopause, a medicine that would stop the ovaries from making estrogen. And in those cases, women, patients, everyone's going to ask, well, what are the side effects of those drugs? And the true answer is there is no side effect. There's only the effect. And whether it's surgical or medical, the effect of not having estrogen is everything you described. It's the hot flashes, vaginal dryness, mood changes, bone loss, all of those things. So surgical menopause is, they
You
had to
forgot
come up
punching your
with
partner.
punching your partner.
Yeah, you need to
Yeah.
punch them once in a while.
Poor Baba. What's he gonna do? Gonna have to get you an extra partner.
Oh gosh.
He's my dinner
So,
buddy. I can't have you punching him.
yeah. What about hormone
Forgetfulness?
ther ther
Sorry,
oh,
I'm looking at the other questions. Go ahead.
oh yeah. Hormone therapy. Does that,
HRT.
yeah, how does that help or not help?
It is mostly safe. A lot of
Okay.
controversies. A few, tricks of the trade about timing, choice of HRT, bioidentical, non-bioidentical. The reality is, um, there are benefits for some women for immediately going on HRT. And these are typically women under 60 who are having severe symptoms, who importantly, don't have heart disease, haven't had blood clots, and don't have breast cancer or a history of breast cancer. And as long as you don't have, those major issues, a short-term use, like 2 years, helps a lot of women over some of the more difficult periods for menopause. And if someone's had a hysterectomy, it's even easier, and we can use a different kind of HRT. Or sometimes women only have issues with vaginal dryness, lubrication, and in that case, you don't have to take a pill, but there's an intravaginal version of estrogen that
Oh,
restores health and youth and happiness pretty quickly. Yeah.
oh,
So HRT
family
is
time.
mostly okay. Yeah. What'd you call it?
Family time.
I'm not sure that's what I call it, but
No, yeah.
yeah.
Anyway,
Or
okay,
maybe
we have
private
been
time.
talking about women all the time. So men actually, some of them, like you said, goes through this symptoms as well, and it's almost sim. Sorry. There's a lot of questions. Yes, I'm sorry,
No.
but I just need to. I'm just
Yeah.
wait. Men,
Wait a minute.
men,
We have
men.
live breaking news. Go ahead.
Yeah, I know. Sorry.
Yeah.
So men goes through all this all
Yeah,
these
they
things
can.
too, right?
Yes.
And the lifestyle, the low carb lifestyle, does help them too.
Oh, yeah. I mean, so when men have low hormones,
Yes,
first of all, as a general rule, menopause is a natural process that happens to all women. But andropause, or lack of male hormone, doesn't happen to all men and doesn't happen at a certain age. It tends to happen because their metabolic health has declined and caused a reduction in testosterone. That could be because of diabetes, insulin resistance, fatty liver. It could be because their sleep schedule or circadian rhythm is so out of balance that they don't make men and women get a huge surge of hormones at about 4:35 in the morning. It's our natural circadian burst, higher cortisol and growth hormone. And for men, there's a surge of testosterone. And, speaking frankly, that's a morning erection. That's why men wake up like that, because they get this surge of
search.
testosterone early in the morning. And if you disrupt that sleep cycle, let these guys rest. Stop bugging us. Let us sleep. Then our hormones go up, our quality of life goes up, we have more muscle, we have, more more of those features, for better or worse, that make us men. But it happens, it can happen at 40. I've seen it in the 30s, even in the mid 20s. Somebody who's really, it's usually sleep disruption. But if you add that to a lot of alcohol, which is sleep disruption, a lot of junk food, typical Western diet, you're going to see that, when in Asia, people don't see this, but you've seen this in US TV. They have those advertisements. Do you feel tired? Do you have less energy? Are you having problems with erections? If so, you should try this medicine, blah, 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 blah. And it's just a generic description that men are so exhausted because they don't have testosterone, and they're eating, they're making poor choices, they don't have time, they don't think they have time to go to the gym or exercise. And regardless of gender, it's the ability to get good sleep, the ability to exercise and build strength, and then make the right food choice.
Okay.
You want to say something?
Yes. So is the cycle is their lifestyle first, and then that goes from then is that their testosterone goes down
Right.
because of the lifestyle.
Correct. It
And
becomes
when
a
that
vicious cycle.
and then when that goes down, meaning you're prone to be fat, you're prone to be diabetic, you're prone to be
Fatty
non-functional,
liver. Yeah. Functional.
everything.
Useless. I've heard that before.
Okay.
Useless.
Oh, yeah. So it's that's the cycle it goes. So, and can you reverse it once you're there, once you're useless?
Absolutely. 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 The key is, so there's these few domains. There's food, there's activity or movement, sleep, exercise. You have to make a change in one domain. And typically that will trigger conversion of a vicious cycle into what I call a virtuous cycle. And you just have to do one thing. And a lot of people, I've seen this so often, particularly in, say, global, the kind of, global people who have a global lifestyle that we had, pre-pandemic, where you would go visit family in the US and then you would take a holiday, and you've been moving around the world and dealing with jet lag and circadian change. Or patients of mine who might be an up and coming CEO and traveling around, and using that kind of example, sometimes these people feel like their life is out of control, that they have to go to dinners because they're the CEO and entertaining clients, and they have to travel because they have to do a road show, and there's always a sense of loss of control. And what you need to remind people and return to them is, you're in control of the food you put in your body, or you're in control of waking up and exercising every day. And the key there is not to demand that somebody wake up and, run 5K every morning, but to wake up and say, I'm going to do 5 push-ups. And just say, I'm going to make this a habit. And that habit could be, I'm not going to have orange juice at breakfast. I'm going to skip breakfast. I'm going to do 5 minutes of yoga every morning. And people might ask you, they'll say, well, do you exercise? And you can say, truthfully, I exercise every day. No one's going to follow up and ask, well, for how long? And but it's that creation of a habit that you just need to do. And once you make those habits, whether it's your food choice, whether it's limiting your drinking, whether it's doing a small version of exercise every day, that's really a turning point for a lot of people. But there are 2 other things, for men especially, that are important. Sometimes that's not enough. And giving a man testosterone for 3 months or 6 months can help break the cycle if their testosterone is very low. And for men and women who have gained enough weight that it causes them to snore, the sleep apnea machine is really useful, because if you're snoring all night long, you're not getting good sleep. And no matter how hard you change your diet, how committed you are to the diet, it's going to be a slow, process if you're physiologically stressed out, because even though you're not awake, your snoring means
You're
that you
not
have
you're
stressful
not
sleep.
asleep.
Right.
Oh,
So the
whoa.
CPAP machine can be a really game-changing kind of intervention for men or women if snoring is happening. Yeah. Make
Wow.
really great invention for people in that spot.
Never
Yeah.
realized sleep is that important.
Uh,
Oh
people who
gosh.
know me know that I've been talking for, the last 20 years about the four pillars: what you eat, how you move, how you think, and sleep. And then lately, in the last year, I tell people I took sleep out of the four pillars, that it's not part of the four pillars anymore. There are only three pillars, and that sleep is the foundation that the other three pillars sit on. It is that important. Yeah, sleep is just absolutely, the word would be foundational. If you're not getting good sleep, what's the point? Yeah.
It's teeth grinding, same
That
as
tends to be
snoring.
a little more, that might be anxiety. That might be stress. I don't know that it's the same impact
I mean,
on
does it does
insulin.
it does it disturb your sleep though?
I'm not sure. That's, thank you, Francisci Tent, because that's not a question I've heard before.
Yeah,
I'll have to check. Yeah.
that's a good one. Yeah,
Yeah.
because my daughter does use my second daughter, she grinds her teeth really loudly. She actually wakes me up.
I'm sure she appreciates that kind of a share. I would barely acknowledge that I have children while I'm on Instagram Live.
Oh, they love me. Okay,
Good,
we have
good.
lots of question here which we can probably address, but it's been going up quite high. Um, I, and my question, I still feel the same feeling like I still have my period, but nothing comes out. Is
Is that
oh
just
wait, 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 wait,
cyclical
wait.
mood
I
change?
don't know. Dr. Tucker, I don't have a womb, but I
Okay.
still have ovaries.
Okay.
I am going to go through the same, am I going to go through the same menopause?
Yes. Yes, you will.
Okay. And
Yes.
then after that, she says, Lucy says, I still feel the same feeling that that I still feel like as if I'm having a period. Is it dangerous to have that feeling?
It is not dangerous to
Mm,
have that feeling.
You
So
know, you
that just
you
means
just
you're still, I mean, life is literally rhythms. There's our
mm,
day-to-day rhythm, like, the morning hormone surge. There's a monthly rhythm, especially in women. I mean, like seasons, there's rhythm. And even though you don't have a womb, if you don't have a womb and you don't have a period to sort of define and announce your cycle, your ovaries are still working, and whatever changes you may feel from estrogen and progesterone, you'll feel, but it's not a
mm.
danger. Not a danger.
Will weight training help with weight gain even after menopause? Hmm.
Yes, that is a straightforward yes. Weight training is probably the most important exercise advice for everyone, especially after the age of 50. I would say that the one of the hallmarks of getting old is loss of muscle
Oh,
mass. And so the more we build muscle, the more we delay aging. Muscle mass and mobility, flexibility, the ability not it's the ability to fall down and get up without injury. That's really what mobility is.
Yeah.
If you're going to slip and fall, you want to roll with it, pop up, and be okay because you're kind of a yoga person and you're strong, but you just really strength and mobility.
I can achieve that.
Running fast is not going to help us live longer.
So it's the flexibility. So I can do that in 5 minutes yoga.
Yep. And strength, weights. Yes.
Okay. Okay.
Uh-huh.
All right. Okay. There's someone just say hello to you.
Hello.
Felia is a big fan.
Oh.
And also, you were also just now trying to address, would you say that forgetfulness can be associated with menopause?
Oh, absolutely. Absolutely. I mean, mood change and cognition are strongly associated with lack of estrogen. So the mood swings, and you could, yeah. I'll just say, it was a strong theory that there's this big study in the 90s called the Women's Health Initiative, where a big giant randomized clinical trial in the US where women were given hormone replacement therapy. And it helped define the risks and the benefits. It's a complicated study and not everyone agrees with all of the results. But one of the ideas was that by taking estrogen, women would enhance or maintain cognition. And while that wasn't definitively proven, it was clear that mood swings and elements of forgetfulness are more common in menopause. Doesn't mean necessarily that taking HRT is going to combat that, but I don't think there's any downside. And it just gets back to the question of safety of HRT, and how do you personalize it? That's really the key, is to understand why somebody needs or considers HRT. Yeah. You can't just say no or yes to everyone.
So I can use menopause as an excuse if I forget.
Well, I think, you can use any excuse you want. You can it'll work in some audience, maybe not in my office.
Oh yeah.
But to a
The next time
stranger who doesn't know you, maybe.
I forgot because I'm menopausal.
Uh-huh. That'll work. Yeah, sure. Tell it to the bank. Uh-huh.
Okay. Is there any age limit to do a hormone therapy? Like until how old can you take it? Like, is that like any risk to that?
So it's generally considered sort of up to age 60, but the answer is no. That you can do it at
Oh,
any age. Um, I think that as one gets, I don't think it's as much about the age of the individual as the duration
mm,
of hormone replacement therapy. So one has to ask, why would an 80-year-old woman who had menopause at 55 suddenly want to go on HRT? And what would the goal be? So at any age, if my patient is complaining of vaginal dryness, physically uncomfortable intercourse, we can give HRT. We can make quality of life a lot better. If an 80-year-old woman says, we find really thin bones, HRT might help her bones, but there are other better ways. So you have to kind of look at both the age and have they already done HRT, and the duration of HRT can be really important too.
so how long can you be taking it? Like if I I'm 35 and if I start now, And why am I talking about this, right?
I think,
Okay.
a decade, but it really has to be personalized. And
Okay.
I see a lot of men who either want or have been given testosterone replacement for their lifestyle, where they weren't sort of advised about not only how they can fix their own testosterone without taking the supplement, but have they been advised sort of what I call the end game, which is if you're 40 and you start taking testosterone because you're exhausted, you've been drinking, you're overweight, you haven't been to the gym, you're successful and working hard, raising your family, and you're not a slouch, but it's just that everything caught up with you. If you start taking testosterone, you have to ask the question is, well, why and for how long? What's the end game? And so as long as you're aware of the end game, to say, I don't mind, I don't mind taking an injection of testosterone every 3 months for the rest of my life because I believe in high dose testosterone. Okay, that's fine. Or if somebody says, well, I don't really want to have to take testosterone the rest of my life. How can do I have to be on this? I'm like, no, but you should change your diet and these things to try to make your own testicles
Combat.
go back to work and make, more testosterone on your own. So you have to always think about what's the end game at any age. Yeah.
Okay.
hmm I see can birth control cause early menopause?
Yeah,
Answer is no.
that's a short one.
Yeah. All
Okay.
right.
Just now I was gonna say something about testosterone, but so is there like genetically is like other than like like a sleep, like a bad lifestyle, does testosterone goes down at all? I mean, as you age,
Generally,
so
no.
it's not like really really. So the andropause, what you call andropause in
Yeah.
men, it's really when testosterone goes down. Is that what it is?
Yeah. But for the most part, men, all other things being equal, men maintain good levels of testosterone throughout their life. And no one has an answer why. It's one of those differences between men and women, just like bone strength or red blood cells. But men continue to make testosterone throughout life, whereas women's ovaries will begin declining around age 50.
So when
Um,
they are consistently making testosterone till they are like in their 70s, meaning that they don't even experience any of those symptoms.
Generally, no. I think some of the symptoms have crossover. If somebody says, are you tired? Are you fatigued? I know people who are fatigued even though they have great testosterone. And one of the things about the kind of medicine I practice with breast cancer patients or prostate cancer patients and being, you know, an expert in the extremes of no hormones or giving tons of hormones is that you become very comfortable with how do you talk to a patient and their family about sex. And there are very interesting words here because you can have high testosterone and no desire, so libido. Or you could have high
Oh.
testosterone but not have an erection. And so when people start talking about, I feel tired or I don't feel sexy or I don't want sex, yeah, we of course want to check the hormone levels, but sometimes they're totally normal and you realize there are other reasons. Like, I'm not interested in what you oddly called family time. um, I'm
My
not
daughters are
interested
here.
in sexy time because, I've got to do our taxes and I'm worried about an audit, or
That's
I'm,
true.
focused somewhere else. And so there's this huge spectrum of, people with hormones who don't want sex, people who have like no hormone levels yet are horny all the time. I've seen every permutation of it, and I'm appreciative for the spectrum of interest, knowledge, and to be able to share those stories, because you have to get comfortable with talking about it. And you can imagine in
What
Asia, not always an easy topic.
what about what about those men's mood swings?
What about it?
Or is it,
There's
I
nothing
don't know.
wrong
I
with
mean,
that. It's perfectly fine.
but if you don't have menopause, why do you have mood swings?
Oh, I don't know, because we didn't get enough to eat, because you woke us up, because our, partner made us do this or that. No, I
Oh,
don't know. Everyone's entitled to a mood swing. You don't have to be.
okay.
Children have mood swings. You can, and that's what I mean,
Okay.
actually, is there's this overlap. People feel tired and fatigued. You don't have to have high or low hormones to be a normal person and to have a bad day. Everyone's entitled to a bad day. Yeah.
Okay. Okay. Fair enough. Fair enough.
Yes.
The next time Ewan has a bad day, I'm gonna say, okay, Dr. Taco says you're
He's
entitled.
entitled to as many bad days as he wants. Uh-huh.
Asa, did you hear that?
She says yes.
Okay, so someone says that I am 6 months without a period and doing keto. Can I still do anything to help the situation? So she wants her periods back.
How old is she?
Oh,
Yeah.
keto Grace, you need keto for Grace. You need to answer me. How old are you?
Uh-huh.
Okay.
I see Asa says she's not cutting me any slack.
Yep.
So Mrs. What is that? 11125? I don't know who that is. What helps
Okay.
vaginal dryness during menopause? Vaginal estrogen. Of course, lubricants, but if it's a serious problem, absolutely vaginal estrogen. Yeah. Keto
Mm,
for Grace is 47.
yeah.
So, six
That's a bit
months.
young.
I think, what we need to know is, are you also having hot flashes? More weight gain that's not explained by diet or exercise or sleep. And you can easily go ask a doctor for your hormone levels to see if you're hitting menopause or not. One of the ways that you can also manipulate, and you've probably seen this, Yanti, and I see it a lot. Someone is hitting menopause or around menopause, late 40s, and then they suddenly get on a healthy lifestyle. They go keto, they hit the gym, and then their periods come back like they're a teenager. And which is great because they feel good, but then they also start, they don't complain. They certainly report that they have more mood swings or more, they notice the hormonal changes more. And I really like to hear those stories because it just proves the point that to a degree we have a lot of control over our body, and that our body responds very swiftly and fiercely to some dietary and lifestyle change. It's not going to prevent menopause forever, but you can definitely regain a degree of youth through dietary manipulation. Yeah.
Yep. I am 56 this year, and last year my doctor says, "Oh, congratulations, I'm giving you a certificate of menopause." So, and I didn't go through, I know, I got a certificate for it, And I didn't go through all the, I do not know. Mood swings, you have to ask Ewan. But I didn't go through all the symptoms because I've been keto, low carb keto for 5 years now. So I'm I don't have a comparison, but if I do talk to my friends who has the hot flashes, who has all the whatever symptoms, I don't have that. So I'm pretty sure it's it's the keto lifestyle that I've
Yeah,
adopted that had eased me through this. And so now that I am what, post menopause or I'm menopause? What is it now?
you're you're
What's
you're menopausal, postmenopause. Yeah, you're
so it's
postmenopausal.
is so I am so I hit the line. I hit the that finish line.
Yeah, yeah.
So
I
I'm
would.
back to I'm normal now. Is that what it is?
You have transitioned appropriately.
Okay.
You have matured gracefully. Yes.
Thank you. I like that word a lot. So I think from personal experience, I did not have all that hot flashes because I see my mom had it. She was still having, I mean, she was having the hot flashes and all that. And I see friends going through it, and I see them with their mood really, really from one end to the other end, and some some headaches, but I did apart from the keto flu I had gone through, I think that was the worst of the worst, and I have actually finished gracefully across across that hurdle of
Yeah.
my milestone.
It happens. It happens to everyone. It happens to all women. And I mean, it can last a long time. And for some women, it's sort of a very brief transition. So I do think that, we'll call it a healthy lifestyle, but I hate the word healthy because everyone's healthy is different. And you have to personalize your choices. And that could be low carb, it could be keto, it could be vegetarian and low carb, and vegetarian and keto. It could be omnivore, carnivore, low carb and keto. What you need to make sure of is that your numbers are in a good range. And when I mean your numbers, I'm talking about like what's your glucose and insulin? What's your triglyceride? What are your liver enzymes? And because there is one thing that's so clear, I think, to both of us, is that there's no perfect diet or no one size fits all kind of approach. You have to choose a diet and a lifestyle, an eating pattern. I hate diet, an eating pattern and a lifestyle that support really, really good metabolic health. And it's nice to talk about this is healthy or this is what I do or my neighbor sold me these vitamins to be healthy and blah, blah, blah. But objective information, like a simple fasting blood test, can tell you not only do you have insulin resistance or fatty liver,
It's done.
really important for so many men to check. And even for women, it's useful to get a testosterone level. Did you know that hot flashes aren't caused by just low estrogen? That men get hot flashes too? Did you know that?
Hey,
Yeah. Hot flashes. So, like, here's a man's estrogen and a man's testosterone in an ideal setting. And for a woman, it's like this. And the thing that causes the hot flash is when the levels match each other. And now you get this flux between low testosterone and low estrogen. And that makes our blood vessels go back and forth and like deliver a ton of, blood flow like a blush to the cheeks, hot. Then cooling and sweaty, and then cold and goes back and forth. It's the flux between testosterone and estrogen. And for both sexes, just looking at your levels is very useful to know where you are and where you want to go. That's objective data.
Hmm.
Yeah. Somebody's
Oh, I love
shaking
that.
their Men get
Did you
hot
see that?
flashes too. Men get
My
hot
heart.
flashes too. That's for sure. It's not about the highs or the lows, it's the change. It's the transition. Uh, yeah.
Oh my God, that's a cute one. Will extended fasting cause menopause to begin earlier? It's
No.
it's good to fast.
Yes. Agree. Agree.
Yeah. Oh, what is humic and fulvic acid?
That I saw that float by. What is that? Humic
This.
and fulvic acid help your body to be healthy. I'm
Mm,
gonna we're gonna answer
uh,
that next month.
sorry. Okay. We'll do our Google first. Okay. Oh, someone wants you to re-mention the three pillars.
So the original 4 pillars are what you eat, what you do, as in sport or activity, how you sleep, and mindfulness, how you think. And I took sleep out of it to make it the foundation. So the 3 pillars are mindfulness, nutrition, and exercise.
Right. But you have to sleep on top of that. Okay, Lindra?
Sleep is the base.
Yes.
Oh, everyone needs good sleep. Who doesn't love
Yes.
good sleep?
Gosh.
Yeah.
Okay. When you don't have enough sleep, does sleeping pills help?
Well, it's a double-edged sword. Um, it depends how bad is your sleep and for how long. I have some patients who have insomnia, medical insomnia, serious sleep disorders that they try to manage along with without medicines for weeks at a time. And it's really useful for them, for example, to take strong sleeping pills for 2 nights in a row for 1 weekend a month. And that gives them restorative sleep, the resilience to deal with the next 3 weeks with bad sleep. So sometimes you just need to get knocked out and recover if you've really been going for 3 weeks straight with like 4 to 5 hours a night. For other people, depending upon why they're not getting, if you're getting bad sleep because you're, having, I don't know, a bottle of red wine every night before bed, sleeping pills are not the answer. It's getting rid of the red wine. And so, sleeping pills aren't always the answer. Um, but I'll tell you, I'm curious what everyone will type in. Melatonin. I encourage people to take melatonin. I don't have a problem with melatonin, but I think there's a trend of people taking really high doses of melatonin, where
What
I've
what is
seen
high?
people like I've heard of people taking 100 and 200 milligrams of melatonin, and uh,
Oh, and
and
it's okay to do that?
I, I, I think it's generally considered as safe. That's kind of actually a technical phrase, GRAS, or what is it? Generally regarded as safe, but it's there's some science and theories behind it. I don't encourage it or recommend it. I know people who do it, but again, everyone, what it tells me is everyone's trying to find good sleep and whatever, by whatever mechanism. And sleep is everything. My best answer for sleep is mechanical. It's the Uller, the cooling pad. Do you
Mm.
remember we talked about it? Yeah.
Yeah.
You haven't ordered yours yet, have you?
No, I don't like cold.
Oh, I love the cold. So the Uller, for those who don't know, is a thin sheet that goes above your mattress and under your bottom sheet, and you can change the temperature pretty widely. And it's like on an automatic timer. It's kind of like a heating blanket, but in this case, a cold blanket. But it can actually get hot. And yeah, no, I love it because I like a cold bed, and I like less aircon but cold sheets. Yeah, that's the
Oh.
key. Yep. Hello,
And
Fairy. Hello, Fairy. How are you? Meditation
and
helps a lot. Breath work.
yes, and you heard of GABA, of
Yeah,
course.
of course. Yeah.
How safe are those?
They're again generally regarded as safe.
Okay.
I think everyone should be cautious when they're introducing supplements, and not go with high dose as the first thing. But you can build towards that if you think it's really valuable. And you should do your own
Okay.
research. Don't do it because I said it or your neighbor said it
I
or that Amway
exactly.
person. Yeah. Uh-huh.
Okay. Okay. Here, Rachel says, "How can I have a good sleep when I got hot flashes every couple of minutes, the entire night?" Oh, okay. You have to go on keto, Rachel.
Yeah.
Uh,
Get the cold blanket. Exactly. Glad we could help.
okay. Oh, seriously, Keto 99, Fran. I want to try an Uller, but my husband doesn't. So, oh gosh, you have to have each of you have to have your own bed.
No, you can get a two temperature. Yeah. Ace and I, we have dual. We have dual. She's 10 degrees warmer than me. Yeah.
Oh, cool.
Uh-huh. Fairy, come
Can we
see
get
me. I haven't seen you in ages.
and can we get addicted to? I think she's talking about
Melatonin?
me-
The answer is
or go
melatonin
ahead.
and Benadryl. I don't know, Andrea. I just don't know. I don't know you, so it's not okay until I know you. If I know you,
Yeah.
then it might be okay. But none of this should be construed as medical advice.
No, this is just a friendly talk.
Yeah. I
Okay,
think
I've been on
melatonin is safe.
melatonin 10
Melatonin
years
is
this,
safe.
yeah.
Melatonin is definitely very safe. Yeah.
Okay. Sherry is coming after the pandemic. Uh,
Cool.
well, Ferry, Dr. Tucker can get you in anytime, right?
No problem. It's an Uller, Ivy. It's like the
O
word
O
cooler without a C.
O
Yep.
O L E R.
Yes. You know what, Yanti, we'll have to connect you to the Uller people, and then they can get a seriously keto discount code.
That's been good.
Yeah. Yeah. That's
Maybe I
good.
should try it actually.
Yes.
Yeah,
Yes,
I
you
should
should.
try it. I should try it. Okay, I'll get the number from you. All right. We'll give 2 more minutes for any other questions, or else I think we can call it a night.
It's been a good night. It's a good
It's
night.
it's
Yeah. We all
Thank
good.
you so much. Thank you for doing this.
It's
I've
always
not seen you
fun.
for
It's
yeah.
always fun. I like
We
this
have to
guy,
think of we
we,
have to think of
I
more fun
well,
topic to talk
let's use
about.
the next 90 seconds. What are the other topics that people want to hear for the rest of the year?
Mm,
Right? We need
yes.
we need some ideas. You guys, what do you want to hear about? You want to hear about ice bath? Do you want to hear about uh, sugars or sweeteners, alternatives? Yanti, you're using allulose?
I'm just playing around with it right now. What do you think of it?
It's fascinating. I haven't done any baking with it, but when I've put it in my black coffee, and it's like flat with the glucose meter. Like
It's
it
still
doesn't make, and it tastes like half as sweet
it's
as sugar. Yeah.
yeah, but it's if you just take it like that, it's still not the same as erythritol. But
No, not at all.
I'm I'm still playing. I'm still playing with it. I have like a big sack now in my kitchen.
Yeah.
Yeah,
I
so
bought like a kilo of it and have been using it in different places. But I need to
cool.
bake with it. That's the key.
Okay. Okay, you want okay, I'll send you. I've baked something with it already.
Okay,
Okay.
cool.
Okay.
All right. Well, we'll get more ideas here and then we'll set this up again, in a few more weeks.
Yeah, we can actually also talk about long-term fasting.
Fasting's good. We like fasting.
Mm-hmm.
Yeah. Fasting, anti-cancer, sweeteners. We should talk about, we should do something about blood tests. We should like how to be healthy without seeing the doctor. Yeah.
Oh, everyone would like that. Are
Yeah.
you sure?
Or how to
A lot
automate.
of a lot of doctors will not gonna like you.
Eh, I'm not always the most popular guy anyway. I'm used to it.
Oh, Lucy, there's a lot of keto chips in my store. Go
I
check it
like those
out.
protein
I'm
ones. I
serious.
like the chicken protein ones.
Oh yeah.
Yeah, as long as I
That's
like the
weird.
buffalo flavor. Yes. Yeah. All
All
right.
right.
I'm
Thank
gonna
you
go.
so much. Yes.
Always fun. I'll see you very
Always.
soon. Thanks
Thank you
everybody
so
for
much,
tuning
Dr.
in.
Tucker.
I'll see you guys.
Thank you.
Bye.
Bye.